I'm Ron Petersen, Professor of Neurology and the Cora Canow Professor of Alzheimer's Disease Research from the Mayo Clinic College of Medicine in Rochester, Minnesota. So our group at the Mayo Clinic focuses on the role of biomarkers in the general community and also in individuals who are on the Alzheimer's disease continuum. So we're studying people who live around our institution in what we call Olmsted County, Minnesota, and we randomly sample those individuals throughout the aging spectrum from age 30 to age 90, and we follow them annually with clinical assessments. A subset of them also do biomarkers for us, so they will do imaging studies, MRI scans, up to 3 PET scans, one for glucose, one for amyloid, one for tau. Some do cerebrospinal fluid assessments, and everybody gives blood and DNA. So we have a complete biomarker repertoire on these individuals. We follow them longitudinally, and one of the major questions we're trying to address is how these Alzheimer's disease biomarkers behave in the general community throughout life. So as we all age, we become a little bit forgetful with regard to our daily activities. So the question always comes up, is this the beginning of Alzheimer's disease? And it's a good question, and I'm not sure we can answer that definitively at this point in time. So our work is looking at the behavior of individuals as they age, their memory and thinking abilities in the community, and then looking at the biomarkers for Alzheimer's disease as well. So how much do these biomarkers contribute to our forgetfulness with aging? Do they explain the whole picture? Or is it much broader than just Alzheimer's disease? The answer is, of course, it's much broader than just Alzheimer's disease. But still, the characterization of people as they age, their forgetfulness with this biomarker profile will help us design better clinical trials to try to address treatments for these various pathologies that contribute to aging and cognitive impairment. So our work at Mayo certainly dovetails with a lot of the basic research that's going on here at Penn. Investigators at Penn certainly have been at the forefront of characterizing not only amyloid and Alzheimer's disease, but other pathologies, tau, TDP43, alpha-synuclein. So at the end of the day, it's likely that most people will be affected by multiple proteinopathies as they age. And the work here at Penn has really been at the forefront of that field.